Hi everyone, I am Dr Astha Dayal and I am a consultant in gynecology in Birla Hospital in Gurgaon. So on the occasion of Women's Day, I would like to share a few tips for all women. The first tip is about vaccinations. We recommend a lot of adult vaccines like the flu shot, chickenpox vaccine, hepatitis vaccine, but there are two special vaccines that all women should take. The first is the rubella vaccine, which you should take if you're not immune to rubella, and before planning your pregnancy you should take this shot. The second one is the cervical cancer vaccine. This vaccine has to be taken as 3 doses within 6 months and generally should be taken in the age group of 11 to 15 years where only 2 doses are required, or if you're above 15 then you should take it before your first sexual exposure or as early as you can, and then you need 3 doses. The second tip is on preventive health check. All women should visit a gynecologist at least once a year. We recommend a pap smear once in every 3 years till the age of 30, and above the age of 30 a pap smear and an HPV testing every 5 years. After the age of 40 you should do a mammography every 2 years at least if you don't have a family history, and you do other health checks and especially a heart evaluation after menopause. My third tip is on contraception. Women generally don't know what birth control pills are. They actually think that the emergency contraceptive is the birth control pill, which is not true. The birth control pills are the 21-day tablets that you take throughout the month to prevent a pregnancy. However, I also recommend that even if you're using a birth control pill, you should still be using a barrier method or condoms to prevent a sexually transmitted infection. The fourth tip is that all women should plan to visit their doctor before they plan a pregnancy. In this, which we call a preconceptional visit, we counsel you about your general health. If you're smoking or having alcohol, you should stop it. We check you for diseases and we change your medication to safer options which are safer in pregnancy. If you have any lifestyle issues like obesity or other health problems, we treat that. We start you on folic acid supplements. We do certain tests which could affect your pregnancy, and it is important that you enter a pregnancy in the most healthy state so that you have a smooth sailing course in pregnancy. My last tip, the fifth tip, would be on lifestyle advice. A lot of diseases that we have nowadays like PCOD, diabetes, cancers, they're mostly lifestyle related. So you should not smoke, you should not have alcohol, you should be having a healthy diet, avoid sweets, refined foods, processed foods. You should sleep for about 8 hours at night. You should avoid stress. After menopause, you should take regular calcium supplements to prevent osteoporosis. And as I said, you should have preventive health checks every year. Thank you.